The face looking back at you in the mirror doesn't match the youthful feel inside. There is a way to get that. Dr. Christopher Maloney has all the details on facial rejuvenation. And doctor, there is so much to talk about when we're talking about our face and the look, and kind of we want to match how we feel inside. The first one I think about that kind of comes to my mind is a facelift, and I'm sure that's just one of many things.
Correct. I have a lot of people that come in and say, I don't want a facelift, I just want you to fix my neck. And I say, great, because that's what a facelift does. And what I try to tell people when they come in to see me is there are a lot of different invasive and also non-invasive things that we can do to make someone look better. So obviously everybody's heard of Botox and some of the fillers that we can use to do different things. And those are really minimally invasive with not a lot of downtime. But if someone has a lot of extra skin or fat in their neck and they have a lot of jowls and stuff like that, they're really going to need surgery like a facelift and a neck lift to correct things like that. Likewise, if they have a lot of extra upper and lower eyelid skin or bags under their eyes, there are more invasive techniques that we need to use to correct those problems.
And I love that someone can come in and maybe not know exactly the procedure that they need, but they can come in and say, I don't like this X, Y, and Z, and you can kind of follow into that. Now, if it does turn out that facelift is the procedure we're going to go with, what kind of downtime do we have after that?
Facelifts are really actually have come a long way. We can do facelifts in the office under local anesthesia, or if the patient desires, they can go to sleep. So there are a lot of different options on how to actually perform it. It's an outpatient procedure. People go in the same day, and the scars are really minimally invasive. You really can't see them as they're healing. Oftentimes you can camouflage them with your hair to have your hair in front of your face, covering it while you're healing. All the stitches and all the stitches come out within 5 to 7 days, and you can shower the next day.
And so when we're talking about, covering up the scars, exactly where on the face are the incisions made?
There are small incisions that go in front of the ear, and then it courses behind your ear and then in the hairline.
Okay, so that's why you say it's very easy to kind of
Correct.
camouflage while you're healing. And what about after the healing process? Is it pretty much not available to see, or can we cover it with makeup?
Yeah, the face is actually a privileged area, and we conceal the scars and wrinkles and creases so that they're very hard to see. And oftentimes even patients' hairdresser or barber can't see the scars. So they're placed in really inconspicuous areas because certainly that's what our patients want.
So when we're saying facial rejuvenation, just as a whole, we're talking about everything you were just saying, including doing something in that facelift department. There's so much that can be done now.
Right. When I see a patient for facial rejuvenation, I really try to talk about 3 different things. One is surgical correction, such as a facelift, upper lower eyelid surgery. Then I talk about volume, whether you need fat grafting or fillers. And then the third thing is the surface of their skin. Do they need laser resurfacing or ongoing medical grade skincare to make their skin look as good as the rest of their face?
And I think that's really important to point out. It's not just about the face, like you were talking about, the skin. You want it to be youthful as well. So there's so many different things, whether it's the brow lift or the facelift. And so when someone comes in and they may be a candidate for multiple things, do you let them know what we should do first?
I try to basically examine them together in front of a mirror and say, why don't you tell me what bothers you? And then I complete that by saying, let me show you some of the things that can be corrected so that when you see photos in our book and when we're counseling you, you can see what you may look like if we're going to do those different things. So again, we talk about eyelid surgery and facelift surgery and stuff like that. Then we talk about adding volume if somebody needs it in the nasolabial folds or in, in the marionette line areas. And then obviously we also saw in patients that have had different things done to their skin to complement their results.
It is, and I know you've been here before and we've talked about some of the laser technology that we have. There's so much that can be done, and I think that's the number one thing that a lot of ladies, as they kind of grow a little bit older, are kind of like the little lines around the mouth that you were kind of talking about. What is that something that you might address with? Is that more of like a filler?
Correct. So we have a lot of minimally invasive things that we can do, such as Botox and fillers and skincare, and even some of the light-based therapies, such as Forever Young BBL and some of the light chemical peels, microneedling. All those different things can be done with minimal downtime and without any need for anesthesia. So those are all lots of techniques that can significantly improve how somebody looks without having to go under the knife.
Well, I feel very comfortable that when I come to you, it's not going to just be cookie cutter. You're definitely going to listen to my needs and what I want and how I want to look at the very end and pick what's best to get to that result.
Yeah, you really need a customizable approach. Not every facelift is the same, and not everybody's skin is treated the same with lasers and the different modalities that we have. So it's important for people to tell us what bothers them and also have us educate them on all the different things they can do to improve how they look.
Well, the first thing they have to do is step into the office, right?
That's right.
That's what they need to do. Definitely come and see Dr. Christopher. Thank you so much for stopping by as well.
Thanks for having me.
Absolutely. If you are interested in looking years younger, who doesn't, with facial rejuvenation, Dr. Maloney has the solution for you. To get in touch with him and his team, you can call 298-2330 or log on to maloneyplasticsurgery.com. Stick around, the Morning Blend. We'll be right back.